Hello, this is Dr. Stanley Lau. Today I want to talk to you about testing for COVID-19. It's very important that you understand what types of tests are available to you when you get the test done. We spoke with two specialists at Garfield Medical Center to get more insight. Dr. Arthur Williams is Garfield Medical Center Laboratory Medical Director. He oversees the samples and maintains the quality of all testing materials that come through the hospital. Dr. Mike Lee is an infectious disease specialist. He's also the appointed physician advisor for the COVID-19 task force at Garfield Medical Center. They will go into how testing works and the methods available to the people at this moment.
The PCR test, which is really the gold standard, is a molecular biology test which actually identifies the presence of the virus or parts of the viral particle in the patient. That the main component is a flexible wire with a cotton-like tip on it that is passed into the nose and up into the back of the oral pharynx, which is the space behind the nose, and try to get a very good swab application with a lot of moist material on the end, hopefully picking up the virus if it's present in that patient. And we then send that out to an outside reference laboratory because we don't have the equipment here to, at this point in time, to run that test. So it goes to an outside reference laboratory, and we now have pretty good turnaround time from that lab. It's sometimes less than 24 hours, but rarely more than 24 or 36 hours. So we're pretty happy with that turnaround time.
And because sometimes you heard about people swab one time, did not get it, and sometimes there's a false, that's what they call false negative. That's when you have infection, but the test didn't perform well and you come back with negative. But actually, sometimes we have to repeat the test if we suspect that you do have COVID. So we want to make sure that we don't miss any cases and send you home and you spread to somebody else.
We're also working very hard to try to develop the antibody test for COVID-19. The antibody test is really testing the patient's body to see if they're responding with their immune system, producing antibodies to try to kill and eliminate the COVID-19 virus.
And then after 5-6 days, you have something produce an antibody, and then up to a week to 2 weeks, then your body, if you get the infection, then your body produce antibody to protect you. That's the blood test will be helpful at that time.
The antibody doesn't come up right away. You become infected, and then your immune system identifies that there's a foreign substance, a stranger in your body, and then begins to attack and identifies the characteristics of that virus, and then starts producing antibodies.
So when you test it today, you may not get it. So it takes about 2 to 3 days. Most of the time, about 4 or 5 days, that's when the virus multiplies enough in your system. And when you will test it, it will be positive. But if you test it early, it may not be helpful. So that's the reason why sometimes you get a result maybe negative. That's why the Department of Health said that don't test it right away, because you need to have a little symptom before they can get a result.
So in conclusion, there are two possible methods for testing. The PCR method tests for the existence of the virus genes, and this is obtained through your nose or mouth by swabbing. The PCR method tests the virus itself, whereas the antibody method tests the response from you. The antibody test is done by the blood sample, and you test your blood for immunity and for existing antibodies, because as the virus develops, your body will fight and produce these antibodies to attack and kill the virus. Finding the antibodies in your blood is different from locating the virus itself. And so this is why the PCR method is the gold standard. If the virus exists at all, the PCR will detect it. But most importantly, with both methods, there is a time gap in which the virus in your body needs before any test able to show a positive test. If too little time has passed and not enough of the virus genes have developed in your body, or the antibodies have not yet formed in your blood, we may not be able to detect infection, which can lead to a false negative result. And that is why it is important to be patient and contact your healthcare provider if you start having symptoms, and they will advise you the best. The information is not limited to Garfield Medical Center. This is for all the places that are testing for COVID-19. If you have any questions or comments, please write them in the comments box below. I will get back to you as soon as possible. Until next time, thank you for watching.